when you compare institutional care to family-based care, what we can see is a model that provides the basic physical needs of a child, but the development of a life, the development of a child requires emotional connection, it requires understanding, it requires the building of identity based on shared memories, and it requires an investment in the emotional and social development of the child. Institutions are resourced and staffed in a way that doesn't really enable any of that. So it can lead to deficits in language, it can lead to psychological problems in insecure attachment. If children are not receiving responsive caregiving, they read it as a threat, and that can result in trauma and other problems that lead to lasting inequality and prevent the child from reaching their ability. It is true that there is a lot of violence and neglect in families. However, the families that children from state care should go into need to be regulated and monitored and assessed and supported in delivering optimum care. Well, that's a risk, and that's why it's essential that local centres for social work are equipped to support foster carers, that recruitments target rural and urban areas to recruit foster parents, and that communities are aware of what's going on, that there is a direct communication between service providers, between the government and civil society and the community, including potential foster parents. I don't think anybody could disagree with that. I think that you have to protect the social worker or the police officer or the nurse going into a difficult and complex family environment, or managing complex emotional issues with children in state care. At the same time, you're obviously duty-bound to ensure the best interests of the child at all times. But there is some complexity around that. The thing is, the child is afforded a say in decisions about them in the context of their evolving capacity. However, what we'd like to see is a care system that does the kind of decisions that good parents would make. And sometimes those decisions may be not what the child wants, but they may actually reflect the real rights of the child, the right of the child to be protected, to be loved, to have a place in school. So I think these are issues to which there are fairly straightforward solutions. However, the implementation systematically remains a challenge, partially because of poor understanding and limitations of performance in the sectors. From my own experience, well, I felt that when I was a child in care, I never had a serious conversation with that adult until I met a teacher when I was 15 who kind of showed an interest in me and supported me to develop and build a better life and a sense of a future. So I think it's an inherent problem of being in care of the state, that people won't listen to you or communicate with you in the same way that a child in a good family setting would. So I think it's really important from that point of view. I think it's also really important that the uniqueness of being from state care is understood by society. There's just been in the United Kingdom a book produced by written by the Lemsisay, who's a national poet, very well known. He talks about growing up in state care, and for the first time he's talking in real depth and with emotional presence about problems of growing up without memories that are shared, of growing up maybe without photographs of yourself in childhood, without having a sense of belonging, feeling detached and disconnected. And I think that story needs to be represented. Often often when people tell a story of young people from institutional care, they talk about poverty because everybody's comfortable talking about poverty, but they're not talking about the profound emotional disadvantage of coming from institutional care. And I think that story needs to be told. And then thirdly, I think that young people need to have the right to be involved in decisions that affect their lives, and so in their evolving capacities, it's important that what happens in their life is the outcome of a discussion that involves their viewpoint. Also, I think that one of the things that came out in Legacy State's book was that nobody expected our generation of young people from institutions to go to university. It just was not expected. Nobody had. I think in the book he said that nobody has the aspirations for you. And what I'd like to see is that care workers and the state have massive aspirations for young people leaving institutional and foster care, that they want them to be the best version of themselves. They want them to have secure attachment, to have healed from trauma, and to be able to achieve their dreams. And I think these are the type of things that we really need to talk about if we're going to talk about improving the situation of young people from state care. Yes, there is vulnerability. When we talk about vulnerability, we talk about some of the things we talk about are people in situations of dysfunctional families, of emotional neglect, of addiction, of houses where there is criminality, where there is violence and domestic violence. And what happens in that situation is that people's stress response system is chronically activated. They are on the defensive. Often they are in a situation of high agitation, often, and what needs to happen is to create the calm conditions for them to be able to make optimum choices about what should happen next in their life, and for that choice to be part of a discussion with the authority. But the authority is paramount in ensuring the rights of the child. So there has to be a balance between service users and the state, but it has to be trauma informed to recognise the way that vulnerability and crisis in families also impacts decision making. Well, you've got to have first-class recruitment of foster carers. You throw the net wider. We in Montenegro, I think that we recruited people whose parents, whose children had grown up and left home. They had free time. They were very loving, warm families that were visited and understood by the social work centres, and they did well, we think, as foster carers. So we need to do that. I think we need to ensure that the aspirations of a community-based service that ensures the right to a family are understood across society, particularly with regard to children with disability, because 50% or more of children in state care in any of the countries in Southeast Europe have disability. So I think that's really important, that we work on explaining that those kids have got a right to a family and a right to school, and it's in a broader inclusion discussion. Firstly, it's important not just to work on the technical capacity of social workers and foster carers and others, but it's also important to address things like their motivation, how they are supported, the system in which they are expected to function, and how continual support can be provided. I think that's really important. Often, as international organisations or governments, there's a tendency to focus on technical knowledge, but the real issue can be motivation. So looking at behavioural science to address motivation at the same time as building technical capacity is really important. I think leadership in the sector is really important as well, to have a motivated social work force in any given area. There has to be heads of social work centres that are good leaders, that are motivated and are able to build networks with other services such as the police and health systems so they can function in a more collaborative way. I think that's really important. I also think having an honest, open communication where you listen and talk with communities about things like emotional neglect, about disability exclusion, about domestic violence. Wherever I have been in North Macedonia or before in Montenegro and had a public discussion on this in a community, people have identified with it, they have understood it, it relates to their lived experience. So more of those type of conversations can help us to ensure that the reasons for child protection systems, social work interventions, community-based services are understood by the whole community. I think international organisations need to firstly understand the cultural context in which they are working, to make good connections with service providers and those that are struggling through the reform process, and provide technical assistance, but also the advocacy knowledge, the communication knowledge, some behavioural science, also the understanding of basic standards, and also I think bringing some of the knowledge of child development into the process as well. You know, child development is really evolving primarily because people are putting together the disciplines of neuroscience, epigenetics, psychology with sociology and economics and other things into a big package that is helping us to understand child development in a way that we've never understood it before. And I think it's really important that organisations like UNICEF and the World Bank and OECD are on top of that and able to provide support to social work, education, health and police systems in delivering really high quality support.